Namaskar, hello, and a very, very good afternoon. Ajke Sunday, and Sunday is the day when we actually tell each other, yes, we can because we will. মোটিভেট 2024 এই জার্নিতে আমরা সবাই একত্র এবং এই যে জার্নিটা সেখানে কিন্তু রয়েছে প্রায় 1100 মেম্বার। সো আমাদের সাথে যারা এখনো মোটিভেটেড দলে আসোনি, এই গ্রুপে জয়েন করে ইউ ক্যান বি আ পার্ট অফ আ গ্রুপ which is full of positivity and there is so much that can be done. আমাদের সাথে আজকে কিন্তু ডক্টর Saurav Das join করছেন and it is with great pleasure that we will be having sir with us. So without any further delay, let me have the pleasure of welcoming him. Hello and good afternoon. I hope you're not driving.
No, I'm not driving. My driver is there, so not a problem. Tell me.
Okay. Dr. Das, আপনি ট্রাভেল করতে করতে আজকে আমাদের সাথে থাকবেন?
Yes, travel. But I'm returning back to Kolkata. I went outskirt, so just returning back to Kolkata. Tell me.
Okay. Thank you so much for your time. I think this is very interesting. আপনাকে দেখে অনেকেই good afternoon পাঠাচ্ছে. So the first question we want to ask you is that in spite of having such a heavy busy schedule because আপনি Apollo Multispecialty Hospitals এ রয়েছেন. So the first thing we would want to know is that how do you maintain your lifestyle because you are a very active person. Professionally আপনি সবসময় নিজের হেলথের ব্যাপারেও খুবই কেয়ারফুল, so would love to know that.
To start with, actually, it was a lovely introduction from your side. Our life as such is full of stress as well as it is very hectic. But yes, you need to find out time for yourself. Well, because proper rest, proper rest and exercise on a regular basis has to be there in your life if you need to keep going. The main problem is that in our life, if as a cardiologist, the kind of hours, the number of hours which we put in to do our procedures or the kind of stress which we have on a daily basis, it really takes a toll on your body if you're not taking proper care in terms of your diet, in terms of putting a check on your weight, as well as in taking insufficient rest. So I feel that taking proper rest at regular intervals. Number two, proper diet. You should be knowing what exactly you are taking inside your body. It's very, very important. Number three is exercise. It's of paramount importance because your body needs some form of training, physical training to keep you going. Whether you are a doctor or whatever you may be in whichever profession, you need to have a certain amount of exercise is on a daily basis, or for that matter, at least 4 times in a week. We say cumulatively we should be having at least 75 minutes of exercise, cumulative exercise in a week, ideally. And the food which you take is of utmost importance, and at least 6 to 7 hours of good sleep. So these three things really plays an important role in keeping me healthy, even in my busy schedule. To add up to this, we really are doing great in our profession. Like my unit is headed by Dr. Shivro Banerjee, and we are doing the highest number of cases in Apollo Hospital, Kolkata. So when you do 150, 160 cases with around 30 to 40 pluses in a month, it really it really puts up a lot of huge toll on your health as well as physical, both as well mental also. So I feel that you need to channelize your energy, you need to relax a bit, you need to take proper rest in between, and the key is rest, exercise, and proper food. These three things really pushes you to a healthy lifestyle, despite of having a very hectic lifestyle in at the backdrop.
Right. So Dr. Das, you yourself, you are always charged up. আপনি নিজে ভীষণ কনসিয়াস and you have always been a great support. আপনার অনেকগুলো ছবি আমরা এখন অন স্ক্রিন দেখতে পাচ্ছি, and each picture you just it's a dapper look. So আমরা খুব হ্যাপি আপনি আমাদের মোটিভেটর, এবং মোটিভেটেড হিসেবে আপনাকে আমরা পেয়েছি, and it has always been a pleasure to felicitate you and have you as a part of the group. Now coming back to the audience, আমাদের সাথে যারা আছেন, যেখানে আছেন, you have the pleasure and privilege of asking Dr. Das anything that you would want. অয়ন্দিতা চক্রবর্তী ভট্টাচার্য একটা প্রশ্ন করেছে, অনেক সময় শুনেছি কিছু মানুষের 60 বা 70% হার্ট ব্লকেজ হয়ে থাকে, কিন্তু বাইরে থেকে কিছু বোঝা যায় না। কিভাবে বুঝবো এইসব সিচুয়েশন কিভাবে হ্যান্ডেল করবো?
Okay. Let me add up. In females, particularly in females, chest pain is very uncommon. If a elderly female, say, or a mid-aged female in above 40 years of age, if she is complaining of some chest discomfort or some chest pain, then it should not be taken lightly. Rather, they should be evaluated it as a whole in terms of doing echocardiography, cardiac enzymes, and if possible, we should also go for an coronary angiogram to rule out coronary artery disease. But I will say, hey, if a patient is obese, diabetic, take say at least for more than 5 years, the patient is taking medications. The patient's HbA1c is more than 7.5. If patient is complaining of some form of chest discomfort on physical exertion, or there is sweating, excessive sweating, then these are some cardinal features, as you know, that the lady or the person should be worried about it, and should do a thorough cardiac examination prior to taking our decision for coronary angiogram. So, even if you have a 70 to 80% of stenosis, is if we have not done the angiogram, and if you see that the patient is complaining of such symptoms, it is a red flag sign to undergo coronary angiogram or thorough physical examination to find out what exactly it is.
Dr. Das, it seems আপনি অ্যাপোলোতে ঢুকে গেছেন already, and today is a work day for you, in spite of it being a Sunday. ডাক্তারদের কোনোদিনও কিন্তু সানডে হয় না, বিকজ
আমাদের সানডে থাকে না।
ছুটির দিনেও পেশেন্টরা কেউ ছাড়ে না, স্যার একটু এটা হয়েছে ওটা হয়েছে,
দেখতে হবে।
ফুড হ্যাবিটস নিয়ে প্রশ্ন আছে, ফুড হ্যাবিটস থেকে কি কোন রকম হার্ট হেলথের উপর এফেক্ট করে? সো ফুড হ্যাবিট এন্ড হার্ট, হাউ ইজ
food
একটু শর্ট করে বলেন।
Yes, food habit definitely. As I told you, it is the problem is nowadays most of the individuals are heavily into Zomato, Swiggy, and taking food from outside. The problem is when you take trans fats, when you take processed food, a lot of processed food has got into our market. And processed food, sweet beverages in the form of Coca-Colas, even for the matter of the canned juices, which most of the people are having. The problem is when you take outside food, you don't know. Oh, the oil is always being reused, and not only from cardiac point of view, but also from cancer point of view, it is very harmful because the more the oil which is reheated, reused, it becomes carcinogenic. And number two, taking food from outside, it is really detrimental to your or body in terms of having future cardiovascular diseases, because I've seen most of the individuals who are not maintaining a regular food chart, or who are not regular with their food habits. They come to me with deranged cholesterols, triglycerides, particularly LDL cholesterols, also, which has got high preponderancy to get accumulated in the coronary vessels as plaque. So I feel one should stick to fruits, vegetables, lots of green leaf vegetables, legumes, whole grains, and less of salt intake. Like the salt intake should go down. What we call it as DASH diet. DASH diet means diet which is dietary approach to stop hypertension. So that is referred to as the DASH diet. So in that dash that we have mentioned that a person should be more into lean meat rather than taking processed of red meat. Number two, whole grains in the form of nuts, cereals, whatever it is number three. We should stick more to vegetables, fruits, legumes, plant-based diet. Number four, less of salt. I always tell three things should be avoided if you don't want to get a cardiovascular disease. Three things you need to avoid. Three white things. One is white salt, white sugar, and maida. That is white flour. So these three things should be is highly detrimental to your body. So rather than and that there are options with you. Rather than taking having white salt, you can go for rock salt. Instead of taking white sugar, you can go for brown sugars, or you can go for jaggery powder. And instead of maidas and all, or you can go for various bajra, jowar, or flours are there. So in whole, body is like a temple, and you have to be very, very careful about what is going inside your body. In terms of your dietary habits, once in a blue moon, you can indulge yourself. You can have a cheat day. You can eat outside. But most of the days, you should stick to a strict dietary regime. And instead of binging, instead of keeping a long gap in between meals, I feel that one should have at least 6 to 7 meals in a day, which should be in small amount, so that you don't binge and you don't overeat.
থ্যাংক ইউ সো মাচ ডক্টর দাস, আপনি আজকে আমাদের অনেক কিছু উপদেশ দিচ্ছেন, জাস্ট লাইক অলওয়েজ লট অফ গুড আফটারনুন। আপনার ছবি দেখে আরজু তো আরজু মোল্লা আমাদের একজন ভিউয়ার, উনি তো অনেক হার্টস পাঠিয়েছেন seeing all your Zappa pictures. Now we have got some another very couple of very important questions. Obhiraj Bhattacharya পাঠিয়েছে, how much and what type of exercise is best for heart? মানে how much টা কিন্তু very important, অনেকে ওভার যায়, অনেকে আন্ডার যায়। অপটিমাম এক্সারসাইজ বলতে হার্টের জন্য আমরা কি বুঝি? এন্ড ডক্টর দাস, আপনি একটু ফোনটাকে স্টেডি করে নেবেন, মানে আমার পুরো এবার মনে হচ্ছে এখান থেকে আমার অ্যাপোলো যেতে হবে আর কি।
Yeah, don't worry. I'll put a pacemaker for you. Don't worry. Kidding? No, okay, diet, I will rather put it this way. No, exercise, the amount of exercise one should do. See, before undergoing any exercise, before you go hit to the gym, every person has got a special body type. You cannot compare your body with someone else. So before, if you have any family history of sudden cardiac death or family history of heart ailments, so I will suggest the person who goes into the gym rather should get himself or herself checked thoroughly from cardiac point of view. ECG and echo has to be done. The baseline is ECG and echo has to be done. If ECG and echo is normal, well, they can definitely go and do their exercises. But one has to know the limit of doing physical exertion, and that's very important. So in certain conditions, like if a person is having a hypertrophic cardiomyopathy, or there is a grossly dilated hypertrophied left ventricular walls, or there is condition like aortic stenosis. In such conditions, one should try to avoid going to the gyms or do any strenuous physical activities. But yes, if the person is normal, absolutely normal, then I feel that one should do moderate. Uh, light weights, start with light exercise, and over a period of 15 to 20 days, is they should escalate their physical exertion to moderate level. Well, and once your body acclimates to that physical strenuous process, yes, you can do to moderate to heavy workout depending upon your body type, at least 30 to 40 minutes. It's a day, 4 times in a week or 5 times in a week. And whenever you are going for some cardiac or some very strenuous physical exertion, you have to get yourself checked, or you have to get a green nod from your doctor. Otherwise, please don't ever venture into those kind of physical exertion, and particularly when you are lifting heavy tires, as what we call as functional exercises, pulling up ropes, and doing a bench press or deadlift more than 150, 160 kgs. Before doing that, you almost need to do you need to get a green in nod from your doctor. if you have not having any physical ailments or past history of any cardiac diseases, you can go for it. But yes, you need to accline your body. Ideally speaking, one should do around and, 90 minutes, 70 to 75 to 90 minutes of cumulative exercise in a week. That is an ideal thing. If you can go beyond that, it's good. But definitely start with lighter exercises and then gradually grow up. And once your body is able to accline, you do go heavy exercises. But as such, I feel you should know where to stop. And your baseline heart rate is also plays a very important role in deciding in your degree of physical exertion which you can take. So if you see that, and ideally what we do is 220 minus the age we do, whatever the age is. So suppose a 40-year-old individual is going to the gym. So 220 minus 40, so it is around 180. So 180 is the maximum heart rate which this person will tolerate it at the peak of his exercise. So if you're achieving 80% of your heart rate, peak heart rate during exercise, you need to stop.
রাইট ডক্টর, থ্যাংক ইউ। আমি যতটা থ্যাংক ইউ জানাচ্ছি ততটাই আমাদের অডিয়েন্সও আপনাকে অনেকগুলো থ্যাংক ইউ পাঠিয়েছে। আই এম জাস্ট ট্রাইং টু শো সাম অন স্ক্রিন। We have another very important question. পোস্ট কোভিড ইন্দ্রনীল ভট্টাচার্যের প্রশ্নটা করছে, পোস্ট কোভিড এখন প্রচুর টিনেজার্সদের কার্ডিয়াক অ্যারেস্ট হচ্ছে। সো জানতে চাই, আমরা অ্যানুয়ালি যেরকম অনেক ব্লাড টেস্ট করি টু চেক আর লিভার, কিডনি এটসেট্রা, সেরকম ভাবে কি অ্যানুয়ালি বা হাফ ইয়ারলি হার্ট চেক আপ করার কোনো অপশন আছে? মানে এটা কতটা জরুরি, ইফ ইউ উড লাইক টু সে?
Yes. It has been seen. I think a lot of people are having apprehension that after COVID, there are increased incidents of cardiovascular or thrombotic events. Not only it's the cardiac, like the coronary artery involvement, but there is also involvement of vascular structures like increased incidence of venous thromboembolism, arterial thromboembolism, which we are seeing in COVID patients. I feel that yes, there is a need to worry about it because we don't know what is the side effect of. Still, there is a discrepancy about what the side effects of the Covishield and the Covaxin, which was given to most of the Indian populations. It has got its side effects and its health implications. But I feel that if an individual does regular heart checkup in the form of ECG, echo, as well as doing certain tests like cardiac enzymes. If they are having this symptoms of chest pain or chest discomfort, or there is shortness of breath on exertion, then they can go for cardiac enzymes like CPK, LD, or troponin I, or trop T examinations can be done, which are blood tests. And if the patient has got a strong indication of having blood clot, or there's a family history, or there is any past history of blood dyscrasia or bleeding issues, who's then and they can go for a certain test, just a certain what we may call as coagulation profile. We can see the BTCT, we can see the various parameters, the clotting profiles we can see. So the main issue is such patients and should be on regular checkup, and mainly it depends upon the symptoms. I feel if you are having symptoms, if you are having chest pain and you are a candidate of Covishield, not Covaxin. Covishield is more thrombogenic than Covaxin, and or you had been infected with a moderate to severe or COVID infection in the past, then I feel that you should undergo checkup every 6 to 8 months, once at least for 2 to 3 years, because and just regularize your lifestyle, and that will help.
রাইট ডক্টর, লট অফ থ্যাংক ইউজ পোরিং ইন, অনেক কিছু জানতে পারছে আমরা আপনার কাছ থেকে। we will take another 5-7 minutes from you because I think this is something which a lot of us would want to know. ঘুমের দায়িত্ব বা ঘুমের importance in a heart health. What role does sleep play in heart health? and how can I improve my sleep?
Okay. Okay, I'll reply to this. This is a very important issue, particularly in today's generation, because most of us are into this iPhone or this into Android phones or whatever it is. We have become so gadget savvy that it is taking a toll on our personal health. So I will like to say, whoever is having a doubt, put at least straight away 6 to 7 hours of proper sleep is required for a healthy lifestyle or for a good heart. So let me put it in this way. So it might be a shock to most of the people. Any person who is sleeping after 12, any person who is sleeping after 12 is putting himself or herself into high risk for getting cardiovascular disease in the next 10 to 15 years. So it is not we have something called diurnal variation. We all human beings have got a diurnal variation. So why we sleep at night and why don't we sleep in the morning? So ideally speaking, one should go to sleep by 11 and ideally they should get up by 6:30 or 7 o'clock. But nowadays the problem is people are going into sleep by 2, 3 o'clock, either because of the lifestyle, because of the work issues, or because of the addiction for their phone on or the Netflix, the various OTTs which are coming up, which are providing us entertainment, but it is taking a toll on our health. So most of the people I have seen they're sleeping by 2:30, but they don't have the luxury to sleep beyond on 9 or 10. So they tend to get up by 6 or 6:30 or 7 o'clock. So there is a sleep pattern is only for 4 to 5 hours. So they are deprived of 2 to 3 hours of sleep every day. So invariably this adds on, and this is going to heavily impact on your health on your cardiovascular health system. How it will happen? Because when you are not sleeping properly, your sympathetic surge increases. Your sympathetic nervous system gets activated, and that's why your baseline heart rate will be always on a higher side. Your blood pressure shoots up. Your mental agility goes down. There will be daytime somnolence, daytime sleepiness will be there. So your mental alertness goes down, your heart rate goes up, you become irritated, you become jittery, mental issues happens, you're not able to focus, and definitely it is going to affect your cardiovascular system on a long run. So sleep is very important. So rather I will put it in this way. The best way of putting yourself to going to sleep is please take your phone. There is a rule of 3 to 1. 3 to 1 means there should be at least 3 hours of gap between your eating and going to sleep. So when you eat your dinner and when you go to sleep, it has to be ideally it has to be around 3 hours of gap so that the food is properly digested and you have a good sleep. Number two, that is rule of 3 to 1. Two is within 2 hours, as you're not going to drink any water, you just take water 2 hours prior to going to the sleep. Number one is that is 1 hour before going to the bed. Kindly take your phone and put it in the switch off mode or put it in the flight mode or put it inside your cupboard so that you don't have an access to your phone and you go to sleep. That is the only way out. We have our medications, but medications are just temporary from a temporary point of view. Medications are not going to be of any use if you are not able to regularize your own personal habits. Number three, I will like to suggest that you have to calm down. You have to stop watching OTTs or phone because phone has got UV rays, so it activates and keeps you more alert. Don't take coffee, tea at least 4 hours prior to your sleep because that will keep you going and you will not be sleeping. Don't eat late. Don't eat beverages, hot beverages. Don't see your phone on 1 hour prior to going to your sleep. If you can regularize your sleep habits to at least 6 to 7 hours on one go, or 7 hours of good sleep, proper sleep, if that you win half of the battle, well, most of your cardiovascular problems can be sorted out. Your heart rate, your blood pressure, everything comes under control. Or not even that, your next day, your focus, your or physical ability, your mental ability, everything improves, and it has got it really brings a lot of difference in your lifestyle.
I will ask something which I am facing myself. So আমার
Yeah.
যেহেতু এখন অনেকটা ওজন and I am trying to kind of get into a little routine যেখানে আমি একটু হাঁটার চেষ্টা করি. Whenever I'm trying to walk, even if I'm walking like 20 steps, so I've had my heart checkup of ECG, echo, everything. So everything is normal. Okay. But আমি যখনই একটু হাঁটার চেষ্টা করি, I can feel my heartbeat is really, আমার মনে হয় আমার প্রচন্ড বেশি হার্ট বিট করছে. So is this normal? If it's not, then what should be the way forward?
See, what you mentioned, your heartbeat and your there's a palpitation happening. So what happens once when we start, when we are at rest, is the heart rate and the blood pressure normally it remains between 60 to 100. The heart rate remains between 60 to 100 beats per minute when we are at rest, and ideally it should be around 70 to 80. The heart rate should be between 70 to 80 when you are at rest. You're not doing any physical exertion, and your blood pressure around 120 by 80. That's an ideal blood pressure. But what happens once you start at walking, or when once you start doing physical exertion or whatever it is? What happens? The both the chronotropic as well as the inotropic response of the heart increases, so that it needs to meet up with your physical well, demands. Because when you're walking, or when you're running, or when you're doing a jog, the body needs more energy. The body needs more oxygen. So invariably, the heart has to pump at a greater force at a greater speed. So what we call it as chronotropic response as well as the inotropic response. Inotropic response is a blood pressure response. So I need the pressures to slightly to be on a higher side so that it can pump the blood, but at a good force, and it can supply and it can perfuse the peripheral vessels, or it can perfuse the tissues, the body tissues. And the function of the chronotropic is it increases the heart rate. It increases the heart rate so that at the heart is able to cope up with the uh, physical exertion, or with whatever the situation is the child, the what we call that sympathetic stimulation is done for that. So the normally there is an increase in inotropic and chronotropic response when there is a physical exertion, but there are certain individuals, as Roopsha mentioned, that when she is doing a slight physical exertion and there is a palpitation happening, definitely you need to be checked. We need to do a halter of yours. We need to see what is your baseline. In suppose if I do a baseline ECG of yours was which is for few seconds, so we won't be knowing much about your ECG pattern throughout the day. So in order to know if a person is having a mismatch increase, or I'll say disproportionate increase of rate or blood pressure, or associated with the physical exertion, then the person has to undergo a halter monitoring, what we call as 24 hours halter monitoring or 48 hours of halter monitoring, to see what is the ECG, or what is the electrical rhythm of the heart, and how it is behaving in the 24 or 48 hours, and then we take a call for further evaluation, or to give medication. So in such cases, I'll put Roopsha in one way, because there are certain individuals like obese individuals, those who are, so there are a lot of physical changes which happens, like endothelial dysfunction. There is an increase in nitric oxide. There will be increase in the insulin resistance. So it has been seen that individuals who are very obese, or who are a bit on a higher side, where the BMI is more than 30, the body mass index, when the BMI is more than 30 and the patient is obese, it has been seen that the baseline heart rate is always on the higher side, because their sympathetic surge is on a higher side, because obesity leads to increase in the sympathetic activities. Is these are individuals will have an increase of sympathetic activities. So the baseline in heart rate is always on the higher side. So when these individuals do physical exertion, then invariably the heart rate shoots up. So that's why you feel this palpitation and chest discomfort feeling. So in such cases, we definitely need to do a halter. as well as we need to take good care, and we should reduce our weight, body weight, or we should try to fix new diets which can, or the techniques like um, uh, to calm yourself down, or to decrease your body weight. And medically, we need to do 24 hours halter or 48 hours halter to see what exactly is happening. And definitely, we can add give you beta blockers, those which can decrease your heart rate. Depending it is all individualized. Okay.
Right. So a halter is it something যেটা admit হয়ে করতে হয় নাকি it is like something where
No, no.
person
You
at home?
you can. There's no need to get admitted. You can do it on a OPD basis. There are a lot of places where even in Apollo, even in many diagnostic houses, yes, there are individuals who go to your home and with the device, and they put it for 24 hours, and then after 24 hours they remove it and they do the analysis of the ECG. So it is not required for you to, or for anyone for that matter, who wants to do a 24 hours halter to come to the hospital or get it done or get admitted for that matter. It can be
Right.
done at home itself. Go and do it at home as well.
So the most important thing is that নিজের থেকে ডাক্তারি না করে প্রপার ডাক্তারের কাছে গিয়ে সবকিছু জেনে কিন্তু আমাদের
Mm.
এগোনো উচিত। And anybody, because I have a history, I lost my mother to very
Mm.
sudden cardiac, so I definitely will follow what you have said, and in the খুব শিগগিরই আমি হল্টারের ব্যবস্থা করছি।
No, no.
And
This I'll tell you, for if you have a family history, then I will suggest you should do a ECG, get a echocardiography done from the best of the guys, is to see whether there is any structural heart disease or not. Get a baseline ECG, and definitely a halter. If you're saying that there is a history of palpitation, then 24 hours halter can give you a lot of information. So baseline ECG, 24 hours halter monitoring, and echocardiography from a person, like you can get it done from me or from someone who is very good at echo, who can really see the LV function, who can see whether there is any structural heart disease or not, just to rule out. I think it will be normal only. So these three things has to be done and as quickly as possible. Yeah. If you have
and
a
this
strong family history of sudden cardiac death.
Akdom, this month I'm going to definitely visit Apollo Multispecialty Hospitals and take
Hmm.
the appointment from you and take it forward.
Hmm.
ডক্টর দাস, ভাষা নেই প্রকাশ করার জন্য আন্তরিক ধন্যবাদ জানাচ্ছি। আপনি আমাদের মোটিভেটর এবং এভাবেই আমাদের ইন্সপায়ারদেরকে ইন্সপায়ার করবেন। It was always wonderful having you with us, and it's a pleasure having you as a part of the journey. The journey is very tough because once you have put on a lot of weight, getting back to a normal thing is also a very very big journey. আর তার জন্য সবচেয়ে বেশি দরকার হয় মোটিভেশন। মানে খুব
No,
খুব
I tell you, everything can be controlled. See, there are certain things which is beyond our control, which is beyond our human control. Well, but as far as the health is concerned, it is all under our control. I feel. So the food habits are under our control. The sleeping patterns are under our control. Well, taking stress or not to take stress or be happy, that is also under our control. So there is only few. That I think 90% of the things are under our control. Only 10% of the things are not under our control. So I feel that you just need to, if your mind is strong enough, if you can put in, if you have the dedication, and if you can have that resilience, the grit, you can definitely do it. I have seen so many people, well, turning out so healthy and doing so well in their life. So it's just a push one needs, so that will do.
অ্যাবসলিউটলি অ্যান্ড যারা যারা আমরা রোগা হতে চাই, ডক্টর দাস কিন্তু সবসময় হি ইজ অলওয়েজ অ্যাট ইট, অ্যান্ড ইউ ক্যান হ্যাভ আ লুক অ্যাট how he has always maintained himself in spite of being such a busy doctor. Thank you so very much, Dr. Das, for
Thank
your
you.
most precious
Thank
time and advice. Anything that you would like to tell to the audience before you get on with your duty at Apollo?
you. I will just suggest that anyone who is more than 40 years of age um, should undergo a regular health checkup, particularly cardiac health checkup. Every 6 to 8 months gap they should do, or in annually they should do. And it's a very difficult thing, but I will suggest that one should try to stop smoking. Uh, it is the worst possible thing you are doing to your body, but it is even if you're smoking, try to get down with it. And try to regularize your habit, because our body is like a temple and it has to be respected. If you don't respect your body, maybe you're younger, you're able to pull through, you have that compensatory mechanism going on in your body, when you are able to pull things out. But what after once you hit the age of 50? So sugar and diabetes, this pressure, that is type 2 diabetes and hypertension, is the two most important factor for chronic kidney disease is in India, and also who having this coronary artery disease. So both these are having high mortality, could lead to high mortality in a person. Once regularize, uh, try to regularize things, and in terms of your habits, in terms of your food, in terms of your sleeping patterns, in terms of this, and you will see the wonders happening.
Thank you so very much, Dr. Das, and I know so many calls were coming, and তাও আপনি আমাদের সাথে সময় দিয়েছেন, and in spite
Yeah,
of being so
thank
busy,
you.
we just thank you very much, and I hope to see you this month at Apollo Multispecialty
Yeah,
Hospitals, Kolkata. Thank you,
yeah,
sir.
yeah,
Thank you
yeah.
so
You
much.
can come to Apollo also. You can come to our hospital and we'll get it done for you. Don't worry, I'll
Yes,
do.
of course.
Don't worry.
That's what I
Okay.
said. এই মাসেই আমি definitely পৌঁছেছি
Yeah.
Apollo Multispecialty
Okay.
Hospitals. Thank you, sir. Thank you so much.
Thank
Bye-bye.
you.
It really is such a pleasure, to get information from such renowned doctors. তাই মোটিভেটে কিন্তু আমরা এরকম ডাক্তারদেরকে পাই যাদের কাছে অ্যাপয়েন্টমেন্ট নিয়ে গেলে অবশ্যই পৌঁছতেই পারেন, কিন্তু আপাতত বাড়িতে বসেই কিন্তু অনেক প্রশ্নের উত্তর আমরা পেয়ে যাচ্ছি। সো I thank Apollo Multispecialty Hospitals. I thank them for their constant support. A journey of Motivate 2024 is possible only because we are together. I thank our partners, Senco Gold and Diamonds and RG Cellulars. And when we talk about Senco Gold and Diamonds, Everlight is something that wins everybody's heart. আর অনেকেই আমরা ভাবি নজর না লাগে, একটা ছোট্ট কালো টিকা হয়তো মাথার পেছনেও থাকে, বাট টু মেক লাইফ ইজি, হিয়ার ইজ হোয়াট উই ক্যান ওন। Everlight by Senco, don't take me lightly. নজর না লাগে, এই দারুণ ব্যাপারটা কিন্তু আমরা পেতেই পারি, and it is available at Senco Gold and Diamonds. Visit or shop online. দেশেরও বেশি showroom and stores রয়েছে across the country. So go to your nearest Senco Gold and Diamonds and own one today. And for all lovers of technology, কারণ ফোনই মন, তখন আরজি সেলুলার্স এর একটা ভিডিও হয়ে যায়। So anything tech and technology, 9831544559 হচ্ছে ফোন নাম্বার। আরজি সেলুলার্স পৌঁছে দেবে আপনার যা চাই সেটাই আপনার বাড়িতে, and you can visit any store of RG Cellulars. With this, আজকে আমাদের মোটিভেটেড এপিসোড হচ্ছে শেষ। সোশ্যাল মিডিয়াতে আমরা অনেক কিছু করি, উই গেট এন্টারটেইনড, আমরা সবাইকে দেখি, আমরা কখনো স্টক করি, কখনো কমেন্ট করি, কখনো লাইক করি, বাট এই একটা গ্রুপ যেখানে যাই হয়, এভরিবডি ট্রাইজ টু ইন্সপায়ার অ্যান্ড মোটিভেট ইচ আদার। আ গ্রুপ উইথ অনলি পজিটিভ ভাইব, ইট ইজ রেয়ার, ইজন্ট ইট? প্লিজ আমি অনুরোধ করবো সকলকে, বি আ পার্ট অফ দিস গ্রুপ। আমরা কমেন্টে দিয়ে দিচ্ছি আমাদের গ্রুপ লিঙ্ক। জয়েন আস অ্যান্ড লেটস achieve our goals this year too. With this, thank you once again. ধন্যবাদ জানাচ্ছি Apollo Multispecialty Hospitals, Senco Gold and Diamonds, RG Cellulars, and আপনাকে বা তোমাকে আছো বলেই আমরা রইলাম। Thank you so very much. Take care. Have a great Sunday.